As a Department of Health in KwaZulu-Natal, we are extremely proud to have reached a mark of more than 1 million of our patients on treatment of the 3.5 million that are in the whole country.
Before NIMART, I was just taking bloods and then I will transfer all my patients to the doctor.
Before we were able to prescribe antiretrovirals at clinic level, it was extremely difficult for both patients and nurses.
Our clients had to go to the hospital, and that also meant that they had to have costs added to their expenses.
We weren't able to provide the care, and patients weren't able to access the care due to transport costs, money to go to the hospital, the time spent in doing that. There was a lot of deaths, there was a lot of problems that we were faced with and challenges that we had to overcome, and NIMART has bridged that gap.
Before, maybe a doctor will see maybe about 5 to 10 patients, but now the number has increased.
The training took about 2 weeks. We are not alone, we are with the mentors. To me, I found the mentors very supportive.
You need a mentorship from somebody who's experienced, who's been dealing with patients, because literature alone, without any experiences, is not enough.
With my mentor, I was relaxed. I'd never encountered any problems at all.
In one particular case, I encountered a patient with Stevens-Johnson syndrome. Without my NIMART training, I would never have been able to identify and manage my patient. But thankfully, we were able to pick it up quickly, and he's made an excellent recovery and is doing so well today.
After my NIMART training, I started a taxi rank support group because people were not testing. So I did community dialogues. After that, I learned that 3 taxi drivers had passed on because they couldn't get a chance to go and collect their medicines from our nearest hospital. I then started talking to the taxi rank manager, and we formulated that support group. And today, that support group has 60 clients, and they are all virologically suppressed.
Since we started the program from NIMART, amapilisi ngokusesiwathola kufishane emakliniki.
Njengamanje sekukuhle kakhulu ngoba usuyakwazi ukufisana nonesi, usho yonke into ephethe ngaphakathi kwakho, uyinikeze isikhathi unesi akusize ngendlela ekugculisayo.
We can get 90% of people virally suppressed. We will definitely be able to control this epidemic.
In KZN, we celebrated 1.1 million that are on ARVs, and then nationally we are sitting at 3.2 million people that are on ARVs. So those are some of the things that we think as a South Africa we've achieved, and also for KZN especially, because we continue to be in an epicenter of HIV.
With this, we can truly say that KZN is on its way to achieving the 90-90-90 targets of ending the AIDS epidemic as a public health threat by 2030.
Our patients are living longer, our patients are no more dying because of this expansion of a program that has actually come up through NIMART.
My greatest success is patient came to the clinic with a wheelbarrow, with a 0 CD4. Ooh, I was so scared. I said, God, he was very, very sick. Contacted my mentor and presented the patient. Then my mentor said, okay, carry on. Patient came after 2 weeks. Patient was not bad. Okay, patient came after a month. Patient was looking very well. You could see that the patient is going to make it. I was like very proud. I thought that, no, I need to call myself a doctor, not a sister anymore.
I was diagnosed in 1999. I was still in matric. Because at that time, I was even told that maybe 6 months will be too much for me if I would leave. Eventually, I got stuck at home. It came to a stage where I had to give up all my clothing. So I couldn't come out of the house. Each and every time I will go to the hospital for my treatment, it will be a case of I'll be in a wheelchair. I told myself, no. When I get out of this bed, I'll start to run marathons. I started at a CD4 count of 35 and with a viral load of 88 million. And now my CD4 count, the last time I checked, it was 829 and my viral load was suppressed.
Iqhaza libambile nonesi emakliniki siba nemhlangano njalo ngesonto every Fridays mase sithola ama-calls abantu abadefaultayo mase siyahamba siyoba-trace emphakathini bathole mase sibaphindisela ukuthi baphindele emphakathini.
I-program ka-NIMART isize ngento ezininzi because ngoku into eyenzekayo asisakwazi ukudefault ngenxa ka-NIMART.
Without NIMART training, I don't think I was going to achieve all what I've achieved for my patient.
For us, this is a really proud moment. We've come such a long way, and really our hats are off to the department, and we feel very proud and very excited to have been part of that and still part of it.
Thanks to all the South Africans who have supported this program, and thanks to our sponsors and supporters.
With the NIMART program, I see the light, and that light is glowing. And as it glows, I see people prospering, living for many, many years. People are living.